Hello everyone, welcome back to another recall session. So today we're going to discuss with you about the physiology recall questions of NEET PG 2024. So let us start discussing the questions. So the first question is, what are the effects of posterior lesions in a Brodmann's area 22 in a stroke patient? Brodmann's area 22 is actually located in superior temporal gyrus, and it typically affects receptive speech functions. It is the sensory speech area. Okay, so the answer here is option number B, receptive speech function. The next question is, a 30-year-old female went on vacation and fell asleep while sitting on a beach. After some time, she woke with sunburn. Later, when she went back home, she experienced pain while taking a warm bath at 40 degrees centigrade temperature. Which of the following receptors is responsible for the pain? The receptors responsible for pain during warm bath is innocuous thermal receptor which have perceived ordinarily noxious stimulus, for example warm bath, as a severe pain is also known as allodynia. So the answer here is innocuous thermal receptor allodynia. The next question is, to prevent polyspermy, which reaction occurs in the zona pellucida of the oocyte after fertilization? So this is a simple straightforward question. The reaction occurs in the zona pellucida of the oocyte after fertilization is cortical reaction. So the answer here is option number C, cortical reaction. The next question is, a 60-year-old patient came with a puncture wound on the left chest wall. Radiological investigations confirmed pneumothorax. Which of the following is correct regarding this condition? Okay. So in pneumothorax, lung volume decreased and thoracic volume increased. Okay. So the answer here is option number B, lung volume decreases and thoracic volume increases. Because the air is seen in the pleural cavity which compresses the lungs. That's why lung volume decreases, but there is increase in thoracic volume. The next question is sore test is mediated by which of the following receptors? This is a simple, straightforward, factual question. Sore test is actually mediated by TRPV1 channel. It is known as transient receptor potential vanilloid 1. Okay, so the answer here is option number B, TRPV1 channel. The next question is a patient who underwent right limb amputation 2 years back now presents with severe pain in the limb, that is phantom limb pain. On radiological investigations, what is the finding seen? In phantom limb pain, on radiological investigation of the brain, projection of adjacent fibers to overlap the left somatosensory cortex can be seen. This pain is based on cortical plasticity. Okay, so the answer here is option number C, projection of adjacent fibers to overlap the left somatosensory cortex. The next question is in a type 2 diabetes mellitus patient, serum insulin levels are found to be raised. He is advised to exercise to improve insulin resistance. Which of the following glute will help to improve insulin resistance after exercise? Factual, straightforward question. Increased number of glucose transporter 4 receptors is seen to improve insulin resistance after exercise. This increases insulin dependent uptake of glucose into the cells and contributing to the decrease in insulin resistance. So the answer here is option number D, GLUT4. The next question is which of the following is incorrect about iron absorption? Let us look at the options. Ferri reductase convert Fe plus 2 to Fe plus 3. This one is incorrect. Fe plus 3 is going to converted into Fe plus 2. Ferric to ferrous conversion is seen by the action of the enzyme Ferri reductase. The next option is RBC protoporphyrin is increased in deficiency. This one is completely true statement. Iron excretion is only through skin, gut and urothelial cells. This one is also completely true statement. The last statement is body cannot compensate more than 10 RBC per histopathological field per day is lost in urine. This one is also completely true statement. So the answer here is option number A, Fe plus 2 to Fe plus 3 Ferri reductase conversion. The next question is a 50-year-old patient presents with a chronic tingling sensation in the forearm. A neurological examination is done and appears to be normal. Which of the following receptors are correctly matched? So let us see the receptors and actions. Merkel cells, slow vibration. This one is incorrect. It responds to the sustained pressure in touch. The next option is Meissner's corpuscles stretch. This one is also wrong. It senses tap and flutter. The next option is Pacinian corpuscles fast vibration. This one is completely true statement. And the last statement is Ruffini corpuscles sustained pressure. This one is wrong. It responds to stretch and fluttering vibrations. Okay, so the answer here is option number C, Pacinian corpuscles, fast vibration. The next question is, the patient presented with alcoholic gait and abnormal eye movements, nystagmus, after road traffic accident. Which lobe of the cerebellum is likely affected? So this is showing the alcoholic gait, abnormal eye movements like nystagmus after the road traffic accident. So this is actually showing the part of cerebellum which has vestibular connections and concerned with equilibrium and gait. Loss of it can lead to disturbance of the equilibrium and postural movement, especially during rapid movements. So the part of cerebellum that is responsible for this is flocculonodular lobe. So the answer here is option number A, flocculonodular lobe. The next question is, renal compensation in metabolic acidosis takes time because. Renal compensation in metabolic acidosis usually takes time because it takes actually hours to days to synthesize enzymes that produce ammonium ion. Okay, so the answer here is option number C. It takes hours to days for kidney to synthesize enzymes that produce ammonium ions. Okay, the functioning of the thyroid involves the transport of iodine from the blood to the thyroid follicle. Iodine is transported from the follicle to the colloid. Which pump or channel is for transport of iodine from the follicle to the colloid? Factual straightforward question. Pump or channel for transport of iodine from the follicle to colloid is pendrin channel. So the answer here is option number D, pendrin. The next question is, the resting membrane potential of the nerve is minus 70 millivolt. Increased permeability of which ion is responsible for the resting membrane potential? This is a very simple straightforward question. Increased permeability of potassium ion is responsible for the resting membrane potential. Okay, so the answer here is option number C, potassium. The next question is, arrange the sequence of steps involved at neuromuscular junction end plate potential. So neuromuscular junction end plate potential events. First event happens is calcium entry. The second event that happens is acetylcholine release. Third event that happens is sodium entry. Okay, so the answer here is calcium entry, then acetylcholine, and then sodium entry, option number B. So with this, we complete our recall session. So thank you so much for watching. See you in the next one.